We will move on to a new section, which is seasonal allergic conjunctivitis or vernal keratoconjunctivitis. A 12-year-old boy presents with recurrent attacks of conjunctivitis for the last 2 years with intense itching and ropey discharge. I told you before, right? Intense itching and ropey discharge. Remember, VKC patients have severe itching. It is one of the worst conditions for as far as the symptoms goes, because they will just rub their eyes, keep rubbing their eyes, and we see in our clinical practice. Okay, so diagnosis is see, one more thing, 2 years. Remember, this allergic problem they tend to ignore a lot. So since it's seasonal also, they'll be like, okay, it's cold, this, that, and then they'll ignore it. So they'll be having this on and off for a long period of time. Okay, so answer here definitely is VKC or vernal keratoconjunctivitis. So VKC is, remember, always papillary, not follicular. Okay, there are many important signs you need to know. See, this is how bad it looks. This is called as cobblestone papillae, or cobblestone appearance, or pavement appearance, they say. Okay, 1 second. Yeah, we'll go one by one. Okay, so first remember that it has two components. What is it? One is a conjunctivitis component, the other is a keratitis component. VKC mainly affects the palpable conjunctiva but can also involve the bulbar conjunctiva. Okay, so first we see that it involves the palpable conjunctiva, as we saw in this picture. It is called as cobblestone sign. Secondly, remember, there is excessive ropey discharge. Okay, this ropey discharge, it will come out in threads, and that is called as Maxwell-Lyon sign. Maxwell-Lyon sign. Remember, when it involves the palpable conjunctiva, all of this happens, whereas it involves the bulbar conjunctiva. Okay, so what happens there? You get what we call as Horner-Trantas dots or pseudogerontoxon. See here, gerontoxon is the other name for Arcus. Okay, because this looks like an Argus. Can you see in the limbus? Can you see that there is grayish line? So that is called as pseudogerontoxon. Okay, so this is very important. Pseudogerontoxon seen in the limbus, which is called as pseudogerontoxon. Okay, next is one more important thing you need to know. Here is just above that you saw, right? They are called as bulbar conjunctiva. It shows Horner-Trantas spots, which is basically what is there? There is follicles and everything, all the inflammation happening at the limbus that will lead to formation of Horner-Trantas dots. In this picture, see, these are all Horner-Trantas dots. Okay, next up, one more important finding. Okay, I told you there are two types. One is the palpable disease, the other is a bulbar or the limbal disease. Okay, so remember, vascularization is not prominent. So this can be the odd one out in manifestations. They may ask you an MCQ saying which of the following is a manifestation except. So vascularization, remember, is not commonly seen in VKC. Okay, what are the complications in the cornea? Remember, that is also important. In the cornea, it can classically cause shield ulcers. Okay, shield ulcers. Don't confuse this Herbert-Spitz with Horner-Trantas dots. Okay, both start with H. Herbert-Spitz, this was a very common confusion for me also in my undergraduate days. So Herbert-Spitz is seen in trachoma. Horner-Trantas dots is seen in VKC. Remember that clearly. Okay. Okay. So how do you treat it? You have to, in the acute phase, you need to start them on immunosuppressants like steroid eye drops. Okay, so they are kept on steroid eye drops for quite a longer duration compared to the usual scenario because their inflammation is quite intense. And to wean them off, we use immunomodulators. What do you use immunomodulators like tacrolimus. Okay, and then you use mast cell stabilizers such as olopatadine. Olopatadine is more of an antihistaminic, and chromoglycate, that is a mast stabilizer. What do? They reduce itching by acting on the histaminic receptors. Okay, and histaminic receptors, and also they decrease the release of histamine. Mast cell stabilizers, what do? They decrease the release of histamine. Okay, remember antibiotics do not have any role here. That is very important for you to understand, because the moment you start antibiotics, you have to have a reason in the form of infection. If there is a secondary infection leading to mucopurulent discharge, etc., yes. Just because there is ropey discharge, don't start them on antibiotics.